And our team coverage continues now with a look back at the federal safety guidelines put out by the White House at the very beginning of this pandemic. Our question tonight, did Texas follow them? Channel 2 investigator Robert Arnold live tonight. And Robert, you asked a U.S. senator and a state senator that question.
I did, but if you'll allow me to give you some background, one of the main points of those White House guidelines was that before a state started to reopen, it needed to see a solid 14-day downward trajectory in either the number of new cases being reported each day or a downward trajectory in the percentage of people testing positive. Texas didn't quite hit those benchmarks, but the lawmakers we spoke to say our numbers stayed relatively low and stable until just recently. They also blame the recent spike on not enough people changing their daily habits.
But I do think that, generally speaking, that the state did follow the guidelines from Dr. Fauci, Dr. Birx, and the CDC.
Texas Senator John Cornyn defends the state's decision to reopen.
We've learned from this experience. None of us have been through this before, and so we've seen the guidance evolve over time.
At the beginning of May, Governor Greg Abbott pointed to low mortality rates, stable hospitalization numbers, and the percentage of people testing positive remaining well below the peak in April. This is what the governor said at the beginning of May.
Anything below 7.2% is going to be a good number.
The governor pointed to these plateaus as an indication to move forward with phased reopening. The World Health Organization, on the other hand, recommended not reopening until a state sees a positivity rate 5% or lower for 14 days. Texas only saw these numbers in spurts in mid to late May.
I think generally speaking that the governor has been taking the advice from the very best people that provide that advice, whether it's a CDC. Now, I have a little less confidence in the World Health Organization.
State Senator Paul Bettencourt argues the recent spike is not so much from the reopening as it is people not social distancing, wearing masks, or washing hands.
I think what we have is a socializing problem, not a social distance problem at work.
Bettencourt says the state can't afford another shutdown, and people need to realize these safety precautions have to be part of their daily life.
You have to go out of your way to break those old habits.
Another thing that the governor said during that May news conference was if the positivity rate goes above 10%, then that is a red flag. As you heard at the beginning of our newscast, we are over that mark, and that is why the governor is pausing a further reopening of our state. Reporting live from Sugar Land, Robert Arnold, KPRC, Channel 2 News.